Imagine paying like $3,000 to have a high-tech laser fired into highly sensitive tissue, um, all for a temporary fix.
Yeah, a very temporary fix.
Right, especially when a $10 tube of hormone cream would have done the exact same thing.
Welcome to today's deep dive.
We are definitely getting into it today.
We really are. So if you've been anywhere near a high-end med spa menu or a wellness blog or just scrolling your social feeds lately, you've probably been targeted by ads for this.
That was absolutely everywhere.
Yeah. And we're talking about, well, vaginal rejuvenation. It's pitched to you as this futuristic, lunch break solution to natural bodily changes.
Right, and the way it's presented to the consumer is just fascinating. I mean, it's marketed with this level of sophistication that makes it feel like just another routine cosmetic upgrade.
Like getting your teeth whitened or something.
Exactly, or getting a facial. But the stakes here are so much higher than a facial. We're talking about women navigating very real, often painful physical changes. Yeah, whether that's the aftermath of childbirth or the transition into menopause.
Right, and they're being offered this incredibly high-tech, very expensive, heavily branded fix.
Which is exactly why we gathered a massive stack of sources for this deep dive.
Yeah.
Because our mission today is to figure out how effective is laser vaginal tightening treatment, really?
Because there is a lot of noise out there.
So much noise. We are looking at everything from promotional clinic brochures for devices like HIFU and V-Lace, all the way to rigorous randomized controlled trials.
Yeah, the real medical community data.
Exactly. And official safety guidelines, too, from bodies like the FDA here in the U.S. and NICE, which is the National Institute for Health and Care Excellence over in the U.K.
Because, look, if you're exploring this, you need to know more than what the glossy brochure at the spa claims.
Right. You need the actual facts.
Yeah, we need to look at what the highest levels of medical science actually say about the underlying biology and, the true safety of firing lasers into the pelvic region.
Yeah, that sounds intense when you say it like that.
Well, it is. And we have to look at how long those expensive results actually last.
Okay, so before we can even begin to judge if this technology works, we really need to look under the hood.
Right, let's talk about the mechanics.
Yeah, because when you read these clinic websites, they throw an absolute alphabet soup of acronyms at you. They talk about fractional CO2 lasers, different types of surface lasers, and HIFU.
Right, which stands for high-intensity focused ultrasound.
Right. But beyond the, sci-fi sounding names, what are these machines physically doing to human tissue?
So at their absolute core, and that is controlled thermal injury.
Controlled thermal injury. Okay.
Regardless of whether a machine uses light energy, like a laser,
Mm-hmm.
or sound wave energy, like the ultrasound, the goal is the same. It's to deliver energy that heats the vaginal tissue to a very precise temperature range.
Which is what, exactly?
Usually right between 40 and 45 degrees Celsius.
Okay, hitting that specific temperature zone has to be intentional. What actually happens at 45 degrees?
Well, at that temperature, you aren't completely burning or vaporizing the tissue, but you are causing deliberate microscopic damage. The heat basically denatures the proteins.
Denatures the proteins.
Yeah, it causes the existing collagen helixes in the tissue to unwind and break down.
Oh, wow.
And your body reacts to that sudden heat damage by basically sounding an alarm. It triggers its natural inflammatory healing cascade.
Because it thinks it's under attack.
Exactly. The tissue realizes it's been injured, so it kicks into overdrive to repair the area. And in doing that, it produces two critical things: brand new collagen fibers and new elastin.
Okay, let's unpack this. Rebuilding the scaffolding makes sense on a cellular level.
Yeah.
So this is basically like aerating a lawn.
That's a great way to put it.
Or for a skincare comparison, like microneedling your face. You cause a tiny, highly controlled amount of damage,
Right.
just enough to trick your body into rushing blood and nutrients to that specific area so it heals back stronger.
Yes. Thicker and tighter than it was before the injury. That is a perfect way to visualize it. You are hijacking the body's trauma response to force it to rebuild its own structural scaffolding.
Okay, so that's neocollagenesis. But if the vagina isn't the face, does it matter if you use a laser versus HIFU? What's the difference?
It does matter, yeah. Where these different acronyms and devices actually differ is in how deep they go to trigger that trauma.
Okay.
So the fractional CO2 lasers and those other surface lasers are what we call ablative or microablative.
Which means?
They work primarily on the top mucosal surface of the vagina. They are essentially poking thousands of microscopic holes right in that top layer.
Oh, okay.
Yeah, that's why clinics target them at surface-level issues like severe dryness or fragile tissue.
But I mean, a cell under a microscope is different from a woman just trying to live her life. If the surface lasers handle the top layer, what is the ultrasound option doing? The HIFU.
So HIFU uses focused sound waves to bypass that delicate surface layer entirely. It pushes the energy much deeper into the tissue, down into the structural fascial layers.
Oh, so it goes way underneath.
Right. So the patient's primary complaint isn't dryness, but rather severe vaginal laxity.
Like a feeling of structural looseness after having a baby.
Exactly. HIFU is designed to heat and contract those deeper support muscles and ligaments, rather than just irritating the surface tissue.
Okay, so the biology tracks. You deliberately heat the tissue, cause microscopic damage, and force the body to build new collagen.
Right, that's the theory.
But a theory in a lab is one thing. Does this actually translate to real life for the patients walking into these clinics?
Well, that's the big question.
Because the brochures claim these devices can fix, like, everything, from painful sex to severe daily dryness to mild stress urinary incontinence.
Right, which is that dreaded bladder leak when you sneeze or cough or
Yeah.
jump on a trampoline.
Exactly. So what does the data actually say?
This is where we have to look closely at the short-term clinical data, because frankly, the short-term results are undeniably strong.
Wait, really?
Yeah. When researchers look at the first few months after a treatment, the numbers are highly compelling. For example, there was this study in our sources looking specifically at HIFU treatments and sexual gratification.
Okay.
At the 3-month mark, over 95.5% of the patients reported a noticeable improvement.
Wow. Over 95%. That is a staggering success rate for 3 months.
It is.
And looking at our sources, it's not just isolated to one small study either. There's data from this massive multi-center case series in Italy that tracked over 600 patients.
Yeah, 645 postmenopausal women, to be exact.
Right. And before the laser treatment, they had the women rate their daily discomfort and vaginal dryness on a 10-point scale, the visual analog scale.
And do you remember what the starting score was?
Yeah, the average starting score was an 8.30. That is severe, distracting, daily pain.
It's a level of discomfort that massively impacts your entire quality of life. I mean, it's debilitating.
But then, after just 1 month of treatment, those scores for daily discomfort plummeted. They dropped all the way down to a 2.97.
Right. Dropped by nearly 2/3.
And the scores for painful intercourse were essentially cut in half, too. Here's where it gets really interesting for me, though.
Oh, yeah.
Yeah, because for someone suffering from severe postmenopausal dryness or, bladder leaks when they sneeze, this sounds like an absolute miracle cure with zero downtime.
Oh, totally. I
Yeah.
completely understand why it feels like a miracle when you are in that kind of distress.
You just walk in on your lunch break and it's fixed.
Right. And what's crucial for you to know is that researchers aren't just relying on patients saying they feel better. They use standardized, objective medical tests to physically measure the changes.
Like the Vaginal Health Index, right?
Exactly. The VHI and the Female Sexual Function Index, the FSFI, they test the fluid volume, the pH levels, the physical elasticity.
So they're physically seeing the difference.
Yes. Across the board, in those first few months post-treatment, these validated medical scales consistently show statistically significant improvements. The tissue literally thickens up, becomes more elastic, and produces more lubrication.
So it really does work.
Well, it works in the short term. And for many women, that profound short-term relief is life-changing. But we have to look at the underlying biology of why this is happening.
Okay, what's the catch?
So there's this condition called genitourinary syndrome of menopause, or GSM. When a woman transitions into menopause, her estrogen levels plummet.
Right.
And estrogen is the hormone that keeps vaginal tissue thick, elastic, and supplied with healthy blood flow. When it drops, the tissue physically thins out, loses that blood supply, and becomes incredibly fragile.
And that's what causes the pain and the dryness.
Exactly. So the laser works in the short term by causing an injury that aggressively forces blood flow back into the area, plumping it up.
Wait, so basically they're paying for a biological Band-Aid.
Pretty much.
The body builds the collagen because it thinks it's been attacked, but because the underlying menopause-like, that systemic lack of estrogen is still happening, that new collagen just dies off again.
Precisely. The systemic hormonal environment of the body hasn't changed at all. The injury response is entirely localized. And, in medicine, localized miracles rarely last forever.
Which brings us to the inevitable drop-off, the fade.
Yeah, the fade is real.
If this is just a temporary injury response, how long does the honeymoon phase actually last?
Well, the fundamental problem is that new collagen ages and breaks down, especially without estrogen to support it.
Right.
Let's look at the Purali study from our sources, which tracked patients over a 2-year period.
Okay.
At the 6-month mark, patient satisfaction was incredibly high, sitting at about 92%.
Which is great.
It is. But by 12 months, you start to see the fade. Satisfaction dropped to around 72%.
Okay, starting to slip.
But by the time they hit the 24-month mark, patient satisfaction plummeted to just 25%.
Wait, really? So within 2 years, 75% of women are essentially back to square one.
Yes, the effects just fade away. And we see the exact same trajectory when treating stress urinary incontinence.
The SUI.
Yeah. In one of the studies tracking mild incontinence, the treatment was highly successful shortly after the procedure, like 86.5% efficacy. But at the 12-month mark,
Let me guess, it dropped.
it dropped to 51.9%. The success rate essentially gets cut in half in just a year.
Because the structural support simply doesn't hold up.
Exactly. The researchers explicitly noted that the laser creates a rapid remodeling of collagen through a self-coagulation effect.
Right. Wait, self-coagulation? You mean the laser is essentially cauterizing the tissue as it goes?
Exactly. The laser energy is so intense that as it creates those micro-injuries, it instantly burns and seals the blood vessels.
Oh my God.
Yeah, this creates a very intense rapid burst of localized swelling and collagen repair, which is why those short-term results pop so quickly.
Okay, that makes sense.
But because that effect is limited just to the local surface mucosa, the normal systemic collagen loss eventually resumes and the symptoms return.
But like, even if the results fade, someone listening might be thinking, fine, I'll just go back to the med spa and get a touch-up every year. I'll budget for it.
Right, if you have money, why not?
Exactly. But here is where the research gets genuinely disruptive. Because scientists finally decided to test these expensive lasers head-to-head against the oldest, cheapest standard therapy on the market.
Yes, topical vaginal estrogen cream.
This is perhaps the most revealing data in our entire stack of sources. It's from this highly rigorous, randomized controlled trial called the Velvet trial.
Oh, the Velvet trial is fascinating.
Right? So researchers took women suffering from severe menopausal tissue changes and split them into 2 groups.
Okay,
One group received the high-tech, expensive fractional CO2 laser therapy.
the $3,000 treatment.
Exactly. And the other group was simply prescribed a standard vaginal estrogen cream that they applied themselves at home.
And what do the sources show?
Well, I'm going to push back hard here because the results blew my mind. There was absolutely no statistically significant difference in symptom improvement between the laser and the estrogen cream.
None at all.
Let me repeat that for you listening. They both worked equally well.
Yes, when they measured the vaginal health scores, the natural moisture levels, the reduction in daily pain, the $10 estrogen cream matched the expensive laser therapy almost point for point by the end of the trial.
I mean, I think this is a perfect place for an analogy. Using the laser is like patching a crack in a piece of dry wood, right?
Okay, yeah.
It looks great for a minute, but the wood is still dry. Using the estrogen cream is like fixing the humidity in the room so the wood doesn't dry out and crack in the first place.
That's exactly what's happening biologically.
So my question is, wait a second. If a simple estrogen cream does the exact same thing by actually addressing the root cause, why in the world are people paying anywhere from $800 to $3,000 a session for a laser? Is this just brilliant marketing?
Well, it's a very complex intersection of aggressive marketing and actual medical nuance.
Right.
We do have to be balanced here,
Okay, fair.
because there is a specific subset of patients for whom the laser is an absolute lifeline.
Who are they?
Breast cancer survivors, or women who have had estrogen-dependent tumors, or really any women who simply cannot use hormonal therapy safely.
Oh, I see. That makes total sense. If your oncologist says you absolutely cannot introduce estrogen into your body, this technology provides real, measurable relief.
Right. For those women, having a non-hormonal, localized option that performs just as well as estrogen is a massive medical victory.
Right.
But for everyone else, the vast general population of healthy menopausal or postpartum women,
Yeah.
they're paying a massive premium. They're paying luxury prices for a temporary biological Band-Aid that requires yearly maintenance.
And the worst part is, it's frequently sold by these clinics not as a temporary fix, but as a permanent, magical rejuvenation. And look, if it were just an issue of wasting money on clever marketing, that would be one thing. But the sources we're looking at reveal a much darker reality regarding the physical safety of these devices.
Yeah, this is where the spa marketing severely clashes with the medical reality.
Because if you go to a clinic's website right now, you are going to see buzzwords. Pain-free, non-invasive, zero downtime.
Oh, constantly.
But then you look at the FDA's MOD database.
Right. And for those who don't know, the ModNate database is the official system where adverse, harmful events related to medical devices are reported in the U.S.
Right.
So researchers recently did a cross-sectional analysis of reports specifically linked to lasers and energy-based devices being marketed for vaginal rejuvenation.
And what did they find?
They found 45 reports of severe, long-lasting adverse events.
And we need to slow down here because we are not talking about like a little bit of mild irritation after a procedure.
No, not at all.
The medical reports logged chronic, daily pain, severe burning sensations, permanent scarring, and in a cruel twist of irony, many women reported drastically worsening dyspareunia.
Right, which means painful sex. The laser actually made sexual intercourse far more painful than it was before they saw treatment.
That is just heartbreaking. And the actual case studies logged in the sources are horrifying to read.
We really are.
In one instance, a patient who simply went in for treatment for mild vaginal dryness ended up developing a crescent-shaped fibrous band inside her vaginal canal.
Yeah, because the laser had created so much aggressive scar tissue as it healed that it literally created a stricture.
A stricture, like a
Yeah.
partial physical obstruction.
Exactly.
Wait, so a woman walks into a clinic because she wants to fix some mild dryness, to make sex more comfortable, and she leaves with a literal blockage of scar tissue.
Yes.
And that's permanent.
It is a permanent structural change caused by uncontrolled thermal damage. Oh my God. And there was another documented patient in the sources who suffered vaginal lacerations like actual tearing of the tissue upon trying to resume sexual intercourse after her supposed healing period.
Wait, why did it tear?
Because the laser therapy had caused so much internal scarring that it left her with a foreshortened, completely inelastic vaginal canal.
It did the exact opposite of what the glossy brochure promised.
Literally the exact opposite.
So how is this legal? How are these devices sitting in med spas next to Botox and dermal fillers if they are causing strictures and lacerations?
Well, let's really break down the regulatory loophole here because it is staggering.
Please do.
It comes down to a very subtle but crucial difference between a device being FDA cleared versus FDA approved.
Okay, what's the difference?
Years ago, many of these lasers were originally cleared by the FDA for general surgical uses, meaning the manufacturer proved the laser was really good at safely cutting or coagulating tissue in a controlled surgical environment.
Oh, like dermatology or burning off a wart.
Exactly. They were cleared simply as cutting tools.
So they were cleared to cut tissue safely, but not approved to treat a specific medical condition.
Precisely. To get FDA approval, you have to run years of clinical trials, proving that your device safely and effectively treats a specific disease.
Like the syndrome of menopause.
Right. But once a device is legally cleared as a surgical tool, clinics and manufacturers can essentially use it off-label.
Oh, I see where this is going.
Yeah, they started pointing these cutting tools at the vaginal walls and wrapping it in vague, unregulated marketing terms like rejuvenation.
Because they aren't legally claiming to cure menopause, they're just offering rejuvenation.
Exactly. The commercial application completely outpaced the clinical science.
So what does this all mean for you? There is a massive disconnect here between a spa-like clinic promising a lunch break fix and official body's warning of vaginal strictures and lacerations.
Right. The patients paying top dollar at these high-end med spas are essentially acting as paying guinea pigs for long-term safety data.
Oh.
And the medical community is finally sounding the alarm. Because of these severe, irreversible complications, the FDA actually issued a warning in 2018.
Right, a very stern public safety communication warning directly against using energy-based devices for vaginal rejuvenation.
And ACOG, the American College of Obstetricians and Gynecologists, they had to step in as well.
What did they say?
They put out a formal statement clarifying to the public that vaginal rejuvenation is not a recognized medical or psychiatric diagnosis. It is purely a marketing term.
Just designed to sell a procedure.
Exactly.
And across the pond, the guidance in the UK is just as strict, if not stricter. The NICE guidelines, which dictate the standards of care for the entire National Health Service.
Right.
They specifically reviewed the data on transvaginal laser therapy. And their official recommendation is that these devices for stress urinary incontinence and urogenital atrophy should be used only in research.
Because, as they concluded, the current clinical data on long-term safety and long-term efficacy is simply inadequate.
They just don't know enough yet.
Right. They fully acknowledge that the short-term benefits are real. But the risk of permanent long-term harm, like the scarring and the strictures, combined with the fact that the results just fade away anyway.
It makes it completely unsuitable for routine clinical practice right now.
Exactly.
So let's bring all of this together for you. How effective is laser vaginal tightening treatment, really?
Well, it is a genuinely innovative technology.
Yeah, that absolutely does work in the short term for many women. By deliberately injuring the tissue, it triggers the body's natural collagen-building response.
Right, which can drastically reduce dryness, improve elasticity, and reduce mild incontinence for the first few months.
But the critical takeaway from all of these sources is that it is not a permanent cure.
No. The new collagen ages, and because the systemic hormone levels haven't changed, the symptoms will return, usually within a year or two.
Most importantly, rigorous trials prove it does not outperform standard, inexpensive topical estrogen creams for the general population.
And it carries rare but devastatingly severe risks.
Yeah, like permanent scarring, lacerations, and chronic pain that have the world's most prominent medical bodies demanding the technology be restricted to clinical trials.
So if you are exploring this treatment, it is vital that you weigh the high financial cost and the potential for irreversible thermal injury against standard proven therapies.
Things like localized hormone creams or even pelvic floor physical therapy.
Oh, absolutely. Pelvic floor physical therapy can actually address the root muscular causes of incontinence without ever firing a laser into your body.
Right. It's all about knowing exactly what you are buying and understanding the true risks beyond the soft lighting and the spa brochure.
Always look past the marketing.
But there's one final thought I want to leave you with today. Something to mull over long after this deep dive ends.
Okay, what is it?
We started by talking about how vaginal rejuvenation is popping up everywhere, packaged as this sleek, modern necessity.
Right.
But if the cosmetic industry is this incredibly successful at marketing a surgical-level laser treatment to perfectly healthy women, by pathologizing the completely natural aging process and the entirely normal aftermath of childbirth,
Wow. Yeah.
what other completely normal bodily changes are currently being packaged as medical conditions that require an expensive, high-tech fix?
That is the real question we should all be asking.
Until next time, stay curious.